COVID-19 RSV Influenza A&B Antigen Test Kit. Wash your hands in soapy water and dry thoroughly. Open the box. Check the components before use. Ensure that all test components are kept at room temperature. Ensure that there is sufficient lighting for testing and interpretation. Read the instructions for use before using the test. Remove the test cassette from the sealed pouch, and the test cassette must stay flat on a table during the entire testing. Carefully tear off the sealed foil film on the buffer tube. Gently press the tube through the perforated hole on the box. Open the swab package at stick end and take out the swab. Do not touch the swab tip. Gently insert the entire tip of the swab into one nostril, about 1.5 to 2.0 centimeters. With children, the maximum depth of insertion into the nostril may be 1.0 to 1.5 centimeters. Firmly brush the swab against the inside of the nostril in a circular motion 5 times or more. Remove the swab and repeat the step above in the other nostril using the same swab. Insert the swab in the buffer tube to the bottom. Rotate the swab in the liquid for at least 20 seconds while pressing swab tip against the bottom and sides of the tube. Squeeze the swab tip from the outside of the tube 5 times. Remove the swab while squeezing the sides of the tube. Cover the tube with a dropper cap tightly. Invert the buffer tube. Add 3 drops from the tube into each sample well by gently squeezing the sides of the tube. Set a timer. Read the test result at 15 to 20 minutes. Do not read the result before 15 minutes or after 20 minutes. If both control, C lines are visible, and any other line or multiple lines, no matter how faint, appear at CoV, RSV, A and/or B, the test is positive for that virus. For COVID-19 positive result, the SARS-CoV-2 virus was detected in your sample. It is very likely that you have COVID-19 and are contagious. For RSV positive result, the RSV virus was detected in your sample. It is very likely that you have RSV infection and are contagious. For flu AB positive result, the influenza A or influenza B virus was detected in your sample. It is very likely that you have influenza and are contagious. If both control C lines are visible, but no other lines appear, the test is negative. A negative test result means that SARS-CoV-2, RSV, influenza A, and influenza B viruses were not detected in the sample. A negative result does not rule out COVID-19, RSV infection, and influenza. If the control C line is not visible in either result window, the test is invalid. Invalid result. After the test, collect all parts of the kit and swab specimens in a waste bag and dispose of them with general waste. Wash your hands thoroughly after handling.